Hello and welcome to Wellness Wednesdays. Today's topic is A for arthritis, aches and pains. And today's question, would it be okay to enjoy pain-free living? We've been talking about the A, B, C, D, and E's of health concerns. I'm your host, Barbara Carr, a certified health consultant with Bionic Health today. Today we're talking about A for arthritis, aches and pains. So some of the concerns we're talking about in connection with PEMF influencers or pulsed electromagnetic field influencers are A for arthritis, aches and pains, B for brain and brainwave entrainment, C for cardiac and circulatory concerns, C for cancerous cell concerns, D for diabetes, and E for the effects of electromagnetic fields. We're looking at A for arthritis and aches and pains. 80% of disease process symptoms include aches, pains, and poor circulation. So if we're looking at this aspect of not only arthritis, but just aches and pains in general, it is a huge percentage that is affecting the general population. There are over 140 different conditions or forms of arthritis. Basically, the determination of arthritis is inflammation of the joints. So symptoms of inflammation are redness, swelling, heat, and pain. And this can produce a loss of use and function of the joint. The most common is osteoarthritis or degenerative joint disease. The causes of that are trauma to the joint, infection of the joint, or age-related degeneration. The second most common grouping is inflammatory arthritis, which includes rheumatoid arthritis, bursitis, tendinitis. And pain is due to inflammation, damage, or muscle strain. And I think most of us can identify with one or all of those aspects that we've had over the years. Over 4.6 million adults in Canada report having arthritis. That's 1 in 6 Canadians over the age of 15. Over 50 million adults in the US have doctor-diagnosed arthritis. That's 1 in 5 Americans over the age of 18. And of course, we know this is not just an adult disease or aches and pains along with arthritis. This affects the very young as well. So arthritis ranks first in disabilities in women, ranks third in disabilities in men, is a $33 billion impact in Canadian healthcare costs and lost productivity, $156 billion annually in lost wages and medical expenses in the US. This is a huge, huge concern. So would it be okay to discuss some research on PEMF, or pulsed electromagnetic fields, that target these symptoms of arthritis, aches, and pains? Well, let's look at a couple here. This is pulsed electromagnetic fields in knee osteoarthritis, and this was a double-blind, placebo-controlled, randomized clinical trial done in 2015. 66 patients were included, 60 completed the study. After 1 month, PEMF induced a significant reduction in VAS pain and WOMAC scores compared with the placebo group. Additionally, pain tolerance and physical health improved in PEMF-treated patients. 26% of patients in the PEMF group stopped NSAID or their analgesic therapy, and no adverse events were detected. I mean, that's pretty major. So the conclusion was these results suggest that PEMF therapy is effective for pain management in knee osteoarthritis patients and also affects pain threshold and physical functioning. Now, this was done just after 1 month of utilizing the PEMF system, and 26% of patients within that 1 month period stopped their NSAID or analgesic therapy. So can you imagine after utilizing the system for over, excuse me, over that 1 month period, 2, 3, 4, 5, 6 months? So looking at pulsed electromagnetic field therapy for management of osteoarthritis-related pain, stiffness, and physical function, and this was a clinical experience in the elderly. A total of 33 patients were screened, 28 patients aged between 60 and 83 and affected by bilateral knee osteoarthritis were enrolled in this study. They received PEMF therapy on the right leg for a total of 3 30-minute sessions per week for a period of 6 weeks, while the left leg did not receive any treatment and served as a control. Conclusion: the present study shows that PEMF therapy improves pain, stiffness, and physical function in elderly patients affected by knee osteoarthritis. So what a great control group to actually have the same person, but only one knee at a time. And again, this was done in less than 1 month that they were seeing these results. So looking at low frequency and low intensity pulsed electromagnetic field and its how it exerts its anti-inflammatory effect, basically for the restoration of plasma membrane calcium. So rheumatoid arthritis is a chronic inflammatory disorder that's affecting 1% of the population worldwide. Pulsed electromagnetic field, or PEMF, has a number of well-documented physiological effects on cells and tissues, including anti-inflammatory impact. And this study aims to explore the anti-inflammatory effect of PEMF and its possible mechanism of action in amelioration, or basically making it better, of adjuvant-induced arthritis. So in induced arthritis, they're looking to see whether this is going to make it better. And the conclusion: the results of the study indicated that PEMF could be developed as a potential therapy for rheumatoid arthritis in human beings. Well, this was way back in 2007. So, and these studies have been going on for many, many years, thousands and thousands of studies, all attesting to the fact that pulsed electromagnetic field systems do have a dramatic effect. So looking at the effect of pulsed electromagnetic fields in the treatment of cervical osteoarthritis, and this was a randomized, double-blind, sham-controlled trial. The purpose of this study was to evaluate the effect of electromagnetic field therapy on pain, range of motion, and functional status in patients with cervical osteoarthritis. 34 patients with COA were included in a randomized double-blind study. PEMF was administered to the whole body using a mat 1.8 by 0.6 meters in size. During the treatment, the patients lay on the mat for 30 minutes per session twice a day for 3 weeks. Pain levels in the PEMF group decreased significantly after therapy, but no change was observed in the placebo group. The active range of motion, paravertebral muscle spasm, and neck pain and disability scale scores improved significantly after PEMF therapy. Again, no change was observed in the sham group. The results of this study are promising in that PEMF treatment may offer potential therapeutic adjunct to current COA therapies in the future. And again, this was done in 2006. So, just tremendous aspects of this having potential ramifications within such a short period of time, non-invasive, not causing damage or going under surgery or any other aspect. And within 3 weeks, people noticing this dramatic of change. In 2003, there was a NASA study done, and these studies findings indicated that cells grow faster, are healthier, and live longer when exposed to low-frequency pulsed electromagnetic fields. And they stated that they found the low-amplitude, rapidly time-varying magnetic fields exerted a very potent effect on the proliferation, morphology, and gene expression of the cells in culture. Now, NASA went on to apply for a patent on a pulsed electromagnetic field device based on the research of a countermeasure for bone loss and muscle atrophy. And this paper was presented by researchers at the Johnson Space Center. And they noted that the purpose of these studies is to develop a pulsed electromagnetic field device for use as a non-invasive countermeasure to enhance bone retention, prevent or alleviate muscle atrophy, and augment natural healing and regenerative processes. This research represents a major contribution towards enabling humans to live and work safely in space, which is the reason for doing this, and is especially relevant to projected human space exploration. On Earth, this device could be useful in the treatment of various muscle diseases, age and cancer-related muscle atrophy, osteoporosis, and other bone diseases. So they've gone to the extent of actually taking out a patent for their own PEMF device. So you can check out the NASA study and links to PubMed and many, many more research that's been done on pulse electromagnetic field systems at bionichealthtoday.com/EMF research studies. So we know that pulse electromagnetic fields, or PEMFs, will target 70 to 75 trillion cells. So they're actually targeting every single cell in your body. There's no differentiation. It's just a blanket aspect of targeting everything. And as we've mentioned, thousands of research studies have shown the effectiveness of PEMF at the proper biologically enhancing levels to help reduce aches and pains and increase circulation. So what if there was a way you could introduce positive PEMF to your 70 to 75 trillion cells in the comfort of your own home? What if your cells could resonate with the proper biologically enhancing pulsed electromagnetic field? How would you feel? What cells would you like to target? Whether you're looking to optimize exercise performance in pre-workout, post-workout, or injury management and recovery, to increase productivity and wellness through improved mental focus and stress management, or to increase mobility, decrease aches and pains, and increase circulation. Pulsed electromagnetic field systems can support all these through cellular enhancement. So pulsed electromagnetic field devices for home use have been on the market for more than 2 decades. Swiss Bionic Solutions, the only company in the world with its own in-house research, engineering, development, and manufacturing divisions, is the world leader in PEMF systems for home use. Over 60% of all PEMF systems sold in the world are manufactured and marketed by Swiss Bionic Solutions. The IMRS, or Intelligent Magnetic Resonance System, is a full spectrum of PEMF applications. There's the full body mat with a housing unit. There's 2 local applicators in the form of a probe or a pad for spot areas. There's the integrated sound and light relaxation system with a spa for the brain. And there's an interactive monitoring and regulation system. The interactive monitoring and regulation system is a biofeedback system. It actually listens to the user's body and then adjusts the intensity level according to the heart rate variability. So this has been used clinically in the medical industry for a considerable period of time as an indication of the autonomic nervous system. And again, on the website Bionic Health Today, under the blog area, you can see researcher information that's been done on heart rate variability and get some more information there. Sound and light brain entrainment therapy is a spa for your brain. It melts away stress and improves oxygen circulation. You can enjoy a relaxing, restorative sleep. And this is hugely important when it comes to improving our cellular wellness, because during that deep sleep area is when our body does that regeneration process. So very important that we are able to get into that deep sleep. For many of us, that's not a possibility. It also naturally improves emotional balance and retrains your brain. And again, on bionichealthtoday.com in the blog area, you can watch a video all about the sound and light brain entrainment therapy for your brain. There's a built-in database guide for users in the IMRS, and this is a database from over 20 years of clinical use. There's over 250 conditions and over 2,000 pre-programmed setting guidelines for time and intensity. So they go from A to Z, and you can see just from this picture, there's just a few of the A's that are on the screen here. But going further into this, it actually gives you the pre-programmed setting guidelines for both time and intensity. So tremendous application, and even just looking through here and seeing all the different conditions that pulse electromagnetic fields will have an effect on is quite interesting. How would you compare PEMF systems and their effectiveness? So 4 different aspects. You would want to look at their waveforms, at their intensity settings, at their frequency settings, and at the device safety, registration, and regulatory compliance. So the IMRS full body mat uses a triple sawtooth waveform, one of the most difficult to produce, but also one of the most powerful, along with the square waveform of the IMRS pad. So if we understand waveform formations, the greatest impact or peak voltage will occur with the greatest rise and fall time of the waveform. So we can see at the top that undulating sine wave, and you can see the difference between that compared to the square wave or the sawtooth wave, that it won't have as much of an effect because it doesn't have as great a rise or fall time. Looking at field strength or intensity, the IMRS full body mat has 3 pairs of these tightly wound, pure, non-insulated copper coils for a much more effective penetration and treatment than most systems can offer. The full body mat here, you can see, is scored into 3 different areas with a higher intensity level at the feet, which really emulates the Earth's natural system of earthing, and with a higher intensity, obviously, at the feet than there is at the head. And also, if you're wanting to utilize a system for young children or animals, you could put those the young children or animals up at the top of the mat system, full body mat system, for that lower intensity setting, as well as adjusted on the system itself. The pad applicator contains 2 pairs of the non-insulated copper coils, and they actually reverse polarity every 2 minutes so that your body does not acclimatize. Now, this is a huge difference between a stagnant magnet system, where your body will eventually acclimatize to that and just not produce the continued effect that you would like to see. And this also goes back to the NASA study where they talked about the efficiency of having a rapidly time varying system. The IMRS also has a lower low and a higher high of field strength or intensity to accommodate both chronic and acute conditions. Looking at the aspect of frequency, the IMRS uses natural frequencies that optimize cellular function. And these frequencies are very important too, because at too high a frequency level, that is a non-natural frequency level for our bodies to tolerate, you actually can rupture cells. So this also has the additional benefit of with the built-in biorhythm clock of being able to set the 4 different time settings. So there's a morning, noon, evening, and night setting, and that helps wake you up or calm you down according to the different frequency waveform formations. Looking at device safety, registration, and regulatory compliance, when you're looking at bringing a system into the country of your choice, you want to make sure that that system will be compliant with your country's regulatory and registration and safety compliance aspects. Very important. Plus, you just want to have something that has been safely designated and registered. So Swiss Bionic Solutions, the developer and manufacturer of the IMRS systems, is the only company worldwide which fulfills all country requirements for supplying PEMF devices for home use. So a very important aspect to utilize or when you're utilizing an electronic device. The Omni-One Intelligent Lifestyle System is a new system on the market. It is the only PEMF system based on the Android platform. It's the world's first tablet with a specific high-performance battery, and it's equipped with 2 serial ports to run wellness apps, or WAPs, as they're called. And this allows access to a tremendous range of health, wellness, and fitness-related applications. Now, this is energy medicine of the future that is now. And, going back to the numerous studies that are done on the effectiveness of pulse electromagnetic field systems, we want something that's easily portable, and this functionality of having the Android platform allows you to operate the battery system and take it with you wherever you want to go. So similar to the IMRS, it contains an Omni pad, smaller pad system. It contains contains an omnispot. Now, the omnispot is actually a homogeneous aspect. So there's a pulse electromagnetic field device in both of these spots. You would put them on either side of a joint, say a knee or an elbow or ankle or something. And you will create this homogeneous pinging back and forth effect so that you're getting complete penetration throughout that entire joint area. Very, very effective, and particularly when we're dealing with the aspects of arthritis, aches, and pains. So the OmniMat has a full body pad, and it's scored a little bit easier to take with you. And of course the OmniBrain and the Android tablet with a 6 to 8 hour battery life. And again, just because of the battery pack, you can plug that in beforehand, run your battery up, and then take it wherever you want to go. I've utilized this in the cars I've been driving, having the OmniPad sitting so that I don't have a sore back when I get out of the car, and many other different applications. So we've discussed statistics on how prevalent arthritis is, some of the symptoms of arthritic concerns, some research data on the effectiveness of PEMF within the proper biological window, of course, and how to compare different PEMF systems. How would you like to feel? Would you like to optimize exercise performance in pre-workout, post-workout, or injury management and recovery? Would you like to increase productivity and wellness through improved mental focus and stress management? Or increase mobility, decrease aches and pains, and increase circulation? Are you ready to take the leap? Run the race? Get back in the game of living the active life? And I know for many of us, we have spent years not enjoying life because of aches and pains and poor circulation. We welcome your questions. So please contact us or the friend who introduced you for your personal consultation, and let's get your questions answered. Get started today. And if you'd enjoyed this, we ask that you would please take the opportunity to share this video with your friends and family. So we've been discussing the A, B, C, D, and E's of health concerns with today's topic of A for arthritis, aches and pains. And I'm your host, Barbara Carr, Certified Health Consultant with Bionic Health Today. Thank you so much for attending, and we just really encourage you to take joy in your journey. Have a wonderful day.